Haere mai, from my heart place to your heart place, Alex, to Heart Place Hospital podcast. How are you?
I'm super excited to be here with you.
Oh, it's me too. And I like to start by how I know you as a guest. And you and I were on the Whole Health Medicine Institute round a couple of years ago. So I know we finished January 2 years ago. So we're both Whole Health Medical Institute practitioners with Dr. Lissa Rankin. And that was quite a journey. I was getting up at 4 o'clock each morning every time I was doing that. And that's where I got to meet you. And something I remember about you is I was sort of reflecting today was you had this beautiful chair that you sat on. You had this beautiful chair, and then I still remember a couple of the hot seats that you were on as well. And one in particular I remember was we all experienced an opportunity to share some of our intuitive hits for you, and it was really cool. It was really magical, and it was sort of the first time that I'd really experienced a safe, soft place to practice that. Yeah.
Thank you for bringing us back to that time. It was absolutely magical. I also remember your late nights / early mornings. And I have fond memories throughout the course. But what I do remember is on one of the first calls when we were put in dyads, you and I were put together.
We were. You're right.
Yes. And I still remember that conversation. And it was still in the middle of COVID. And I remember our shares and our experience, and it was such an incredible container. And, just watching you blossom through that and after has been an absolute joy and privilege. And I'm deeply grateful that we get to be here today.
Thank you so much. Gosh, I'm just getting all these downloads as you're saying that, and memories, and we're all gravitated to Lissa Rankin MD, and she's got 7 amazing New York bestseller books, and Mind Over Medicine and Sacred Medicine amongst them. Just a phenomenal, brave clinician. So we were all kind of drawn to her, and I remember the first thing she said was, you think you're all drawn to me, but it's actually going to be you guys together. And she was bang on. And you're right, it was in the middle of COVID, and clearly a lot of us were getting intuitive hits on what the actual was happening. And so we just got curious, and that's how we were all brought together. For me, and I'm sure it was the same with you, it was this beautiful safety net in a time where I really had no idea what was happening, and my tender parts were firing on all cylinders. So yeah.
It was deeply transformative. It was a safe container. It was something that we could all rely on. I know that I could. And I came out of that process a better person, a better doctor, and with a much clearer path. And I know you've mentioned 2 books of Lissa's, Mind Over Medicine and Sacred Medicine. And one of her earlier ones, even that deeply resonates with me, is Anatomy of a Calling. Because what I personally got to tap into through that experience was really, I got to intimately get to know the anatomy of my calling, and that was a beautiful gift.
Yeah, me too. I'm gonna do your bio, because then people can understand our conversation even more. I know for me it was 8 years, almost bang on 8 years ago, that I got the message Care for Carers. And when I discovered Lissa, and that's exactly what she was doing, healing healers, I was like, wow, there's more of us. Like, there's like more of us, which was like a coming home So yeah, but I want to read your bio, and I want everyone to buckle up because this is good. So Alex, or Aleksandra Filipovic, is a medical doctor, PhD. So you're the head of oncology at PureTech Health, a clinical stage biopharma dedicated to developing novel therapies for challenging indications in oncology and other disease areas. You're a medical oncologist practicing at the Imperial College of London, where you hold an honorary lecturer position. You acquired your PhD and completed postdoctoral studies at the Imperial College in the area of cancer cell biology. And from there, you worked at Bristol Myers Squibb and consulted for AstraZeneca. I used to work for AstraZeneca, so that's something else we've got in common, before joining PureTech. In addition to your clinical and scientific drug development roles, you're a scientific and clinical advisor to the Sharing Progress in Cancer Care, SPCC, a global platform that reaches the whole of the oncology community, where you design educational content. You are an accredited holistic clinician, and you work as the Chief Purpose Officer and practitioner of the clinic that you established in 2022, the HEAL Clinic, a place where whole body intelligence comes alive. So HEAL Clinic is rooted in the HEAL technique, standing for health, empowerment, awareness, and love. This approach is dedicated to enhancing self-awareness, increasing self-esteem, releasing past traumas and psychological blocks, and reducing physical symptoms of dis-ease or ailments. This model centers around the integrative healing and a biosomatic approach, which implements flexibly structured questions and expansive experimental interventions of body with the mind, working with the mind, body, and soul through movement, word, breath, silence, and much more. The aim is to promote an empowerment for healing, as well as a clear, realistic, and positive attitude in order to learn and implement new personalised skills for an effective, productive, and functional life. So Alex integrates a whole patient-centred approach into all areas that you practice in. And yeah, we're going to talk more about that today because it's so cool.
Let's do it. Thank you.
I love it. And so yeah, I just guess I want to start and give you the opportunity to really share how Alex got to there.
Yes. Well, I'll start from how I got here, in a sense, how I got to combine all of the areas that are my passion, that being clinical medicine, research and drug development, and finally, that is all beautifully represented in a holistic approach. And it really did happen during COVID. It happened shortly before we enrolled into Whole Health Medicine Institute. And I've been on a personal healing journey for a number of years, probably over a decade. And COVID really represented an important milestone for me because we all got grounded. So did I, in a sense that travel ceased, and travel represented a really big part of my life, both personally and professionally. And that was no longer a part of my life. And all of a sudden, there was all this time that allowed me to pause. And in that, I discovered the gift of the sacred pause. And I will never forget the first quote in that period of time that I gravitated towards. And that quote was, "I find myself in stillness and we breathe." And so that's what I chose to do. And in that stillness, I got to reflect and take a look at my life 2 decades prior. And there were many common patterns that I revisited. They weren't too foreign to me, but I saw them from a different lens. And I simply was the only person that was the common denominator in all of my experiences. Everyone else came and went. They were largely the same person with a different face. But the common denominator was me. And the answer became very clear very quickly, and that was that I was going to choose to dive very, very deep into inner work. And so I did. And that took a village. And to every single person who held me on that journey, I'm deeply grateful. And those people are still my teachers, my mentors, my coaches, my friends. And they have really, really held me. And about a year and a half later, I took healing as a full-time job, literally. I woke up one day, went to work in my clinic, and there was nothing different around me, but something had shifted internally. And what that looked like when I stepped into the clinic was twofold. One, I could literally sense this energetic space had created itself that meant that I could now hold someone else through their own journey. Because I got to acknowledge that I now stood on the other end of so much, thanks to the people who held me. And secondly, there was this crystal clear awareness that being an oncologist who is there for their patients solely for a prescription, a blood test, and a scan is no longer enough. And in that moment, I made a decision and said, I either start doing something differently right now, or this becomes a choice point of another nature. And as the universe would have it, I really believe in serendipity and in timing. The next patient I called in was a wonderful young woman who had a cancer diagnosis many years prior and is still on maintenance therapy, doing very, very well. That day walked in with a foot that got injured and needed an x-ray. But what I heard from her was, but Alex, my other foot that I haven't injured also doesn't want to move. So that also represented the beginning of me listening very carefully to the words and everything in between the words. And again, it was one of those you can't make this thing up moments. I got an immediate flashback of a time in my life 5 years prior where both of my feet wouldn't move. And I said, right, what was going on around me that my body was giving me the message in this way? And I took a chance. I asked this patient a question. I said, I'm going to ask you something that seemingly may have nothing to do with the feet or the cancer, but highly likely has a lot to do with both. Is there anything going on in your personal life that you would like to share with me? Tears came straight away. There was a big release. And that was the beginning of the first holistic session that I ever did. The patient walked out of the room without limping. And I sat there just completely in awe of what had happened. And I remember myself looking up and going, this what just happened here? That's what I want to do. Mm-hmm. Where do I train? That same afternoon, I found Lissa's Whole Health Medicine Institute course, and the rest is history. So that's how it started for me. Mm-hmm. And after WHMI, I then enrolled into another beautiful, epic program called the Elementum Coaching Institute and got qualified to be a master coach. And that training was very well-rounded, incredibly comprehensive and deep, with a component of Heal the Healer and then real in-depth training into trauma healing, somatic techniques and attachment styles and personality patterns and inner child work, internal family systems, some of the neurolinguistic programming techniques, belief system work, a lot of what we did at WHMI, and then a lot of build up upon that. Following Elementum, I was really lucky to enroll also in Howard Schubiner's course on neurocircuitry pain reprocessing and really dealing with what John Sarno commenced as his work with tension myoneuro syndrome, TMS. And I am now training in root cause symptom practice. So the journey just continues, and the teachings are beautiful, and we always get to learn more. And what I'm really excited about is that I am personally really dedicated daily to my own healing. And I don't intend to stop. And healing has really become a lifestyle. And I have seen the massive difference in my life with personal physical symptoms and diseases over the course of a few years, and just everything else has completely shifted. So that's how I get to be here with you.
Oh, I love it. I love it. I've been wanting to share the stories that our news and media don't share around the power of frontline workers, of our healers, and particularly those who, and it took no judgment, because I was getting tapped on my shoulder and 4x4s in the back of my head for years, and it wasn't until I got mat trucked in my face that I started to hear the whispers, and it's the pain to purpose stories that I'm just loving sharing, and put the messy to the messengers. And we were guided through this lifetime to work in the front line, to give back, to help others. But our codes were kind of construed a little bit, and it was to fix and help. Where in actual fact, we're now getting the messages that it's us that we fix and help, and the ripple effect of that is that others benefit from that too. So you've shared that so beautifully, and I love that you've in New Zealand we call a basket a kitty. So I love that your kitty is getting fuller and fuller. I'm assuming that you're a manifesting generator in human design with all that learned. Yeah, and I'm a generator, so my role is to create these platforms and create these spaces so that others can continue to evolve, continue to heal, so we can ripple effect that out to others and to all society. And I see it as a really fast, potent way to do it, because we can all wait for people to get the message, but already people know that when they're in pain or when they're in dis-ease, they will actually eventually get in front of a frontliner. And so it's just such an opportunity for us to heal the healer. We're healing the healers and then to heal the masses. So and so I'm really curious, like, what's that been like? Because that's pretty, you're shaking things up. You're outside, you're moving outside the status quo. Like, what's that been like with your colleagues, with society, with your family, friends? How's that kind of shaped up for you?
Yeah, it's been the most challenging internally, I have to say.
Right, yeah.
It's that inner voice that has been really the companion that I've had to befriend in the past 3 years since I've started stepping into this role of a holistic medicine practitioner. And, I started the Heal Clinic in July 2022. And if I'm really honest, it's taken me a couple of years to fully own the fact that me as an oncologist and a scientist and a drug developer is no different than me as the holistic medicine practitioner. They're actually one. They're one of the same, and they always go together. Whatever I do, it's an integrated approach now. But really to own that and to unapologetically, fully step into this way of being wherever I go and whatever I do has taken nearly 3 years, and primarily because of that inner voice. My colleagues have been supportive. I have shared my journey with some, not with all of them, but I'll tell you there's more people who are like-minded and who have had their own experiences similar to what we're talking about here. But these conversations are few and far apart. So I feel that what you're doing here with your guests and beautiful conversations and invitations and calling forward is going to have a massive effect and a beautiful contribution to further opening the field and allowing more and more people to step forward and to realize that they're not alone, that there is support, that there is someone who is going to say, me too. And that's often all you need to hear for a little bit of support. My family has been hugely supportive. My dad, I'm very happy to say, knew what I was doing and what I started before he passed, because my dad passed in October 2022. But I'm really, really glad that he knew that I started the HEAL Clinic that year in July. And he was really, really supportive. My dad was a medical nuclear physicist. So that's where the scientific part comes from. And then my mom is a medical oncologist, and she's also very supportive. I have to say that the first book around healing was handed to me by my mom, and it was Bernie Siegel's book, Love, Medicine, and Miracles. And then even prior to that, when I was 14 years old, I just remember this recently, I somehow picked up a book off my mom's shelf, which was The Emotions That Heal. So there seemed to have been something in me that knew very, very early on. It just took some time for that seed to fully take, and then break into a full-blown plant and tree, hopefully. My friends have been wonderful, really, really wonderful, and many of them have volunteered for me to practice with full trust. I'm very grateful. And I guess the field where these conversations are only starting to emerge is the biotech sector. And I would say that I've only ever had conversations along these lines with a handful of colleagues, if that. So hopefully we'll get there, because clinical trials and drug development can also be conscious. And in many occasions, it fully is. And then there's room for improvement, of course. But on the clinical medicine side, really there has been a palpable shift that orientates our community towards an awareness towards whole health medicine. And this is something that has brought me really great joy. I have started seeing that personally from, I would say, the end of 2022 onwards. And I will give you an example of that. So our biggest oncology meeting is in every first week of June in Chicago. It's called ASCO, American Society of Clinical Oncology. And this year, well, rather last year already, the president of the society is an incredible doctor called Eric Weiner at Yale, who has delivered a presidential address and left 20,000 people in the room without a single person with a dry eye. It was the most moving presidential address we have seen. His personal story is quite remarkable and a testament to faith, spirit, healing, and medicine going together. And what he has allowed for is bringing the voice of integrative oncology, and also putting the patients front and center, that relationship and their presence and their importance, and also has brought emphasis on medical narrative, which is something that I'm particularly passionate about as well. So there are some very palpable shifts, and I think it's a really beautiful time to be in medicine because we are remembering what being a doctor actually is. And I think it's going to open hearts just around the planet because, you know, we're almost, I'm going to say something perhaps a little bit controversial, but I'll go there. That's okay. We're almost shifting from indoctrinated to doctor. Right? Like, what does a doctor truly mean? What does it mean to be a doctor? We have beautiful tools that Western medicine has given. Absolutely beautiful tools. We have drugs that work well. We have drugs that teach us, and I'm happy to go into that when it comes to oncology, for example. Why don't we listen to those drugs as messengers as well? We can, and they come with very important messages that almost are guideposts as to where are we going, what is possible. And then I will just reference and then pause something that is very dear to my heart, and it really within me lands as truth. And it's something that another great teacher said, and a fellow physician, Dr. Abraham Varghese, the author of a beautiful book called The Covenant of Water. He said the greatest innovation in medicine in the next 10 years will be the human hand. And I believe that.
That was beautiful. I was reflective recently around something similar, and we have used words around that we're training to be a doctor or training to be a nurse or training to be a teacher. And I've been getting messages around how we will be a sharing of knowledge or creating spaces of wisdom, as opposed to this, like you were saying, with the doctorate and the doctor analogy, and that feels good, feels right, it feels like this place that I want to be, the place that I want to play, and the place that I want to bring up my family, and I want their family to bring up their family. And it feels like it's more simple and more sustainable than what we've had, and what we're still hanging on to at the moment. Yeah.
Yes, exactly. And I love something that you said there. You said play. That is so important. It's so important to remember that we can play in all of this. And it doesn't mean that we're irresponsible because we are playing. Not at all. It just means that we get to be creative and we get to really follow our intuition. And there's no innovation without intuition. So it's really that stepping forward into innovation when we say we're playing, we're playful. We're bringing forth something that really wants to be expressed through us.
Yeah, it's true. It's so true. And there's lots of in words in there. There's innovation, intuition. There's, I'm getting a lot into intrinsic, indigenous, inner knowing. There's a lot of inward energy coming out. And I really think this is the panacea to what is going to create our new earth, our new world, and one that we were designed to live in. So much suffering and I'm very good at saying the words. because I come from a place of love. So, but just more and more seeing this expansion of love that's coming through, and that's how we were designed. We were designed, and we were designed to feel. We were designed to have our curveballs, so that we could feel them and reveal them and deal with them and heal them. And you've mentioned it. You know, we weren't designed to do it on our own. We were designed to do it in circle, and I think that's what I'm seeing more and more of, is that real partnership agreement and those healing round tables. And you literally, like, you heal a healer, and out of that one healer you heal thousands. Like, it's, look at you, look at me, through our own healing journeys. And I don't know about you, but to think that I would be in front of people and sharing my intimate healing journey 8 years ago, when I was literally crawling across the floor, I would have just been like, get real. Get real. Get really real, because I literally am not even getting to the bathroom on my own right now. And it's those intimate stories that make us help others, and we're born storytellers. We're literally the witches of the new age, which means wisdom. We're the wisdom sharers and the storytellers, the truth seekers, the earth shakers. We're going against the status quo, which I can totally relate to what you're saying. Mine was in a turmoil. I really did battle with my imposter monster, and still have moments of that. And but just getting better at kicking it to the curb and saying, you know what, we've done this rodeo. We've been here. I'd love to know, like, what's in your heart place right now? What's something you can share from your heart place to those that are listening? And how can people find you?
Right. Well, I'm gonna you've sprinkled some beautiful gems in your share just now. So I absolutely everything in there, and I may dovetail off of one in particular. And you did mention heal, and something that I feel is really important, and it is very much in my heart place and wants to be shared, is, and this applies to every single one of us, really, because in what we're doing, it isn't helping, because helping really assumes that we're above someone. We're not fixing, because that then implies that there's something wrong with the other person. We are really serving, and we're in a place of service. Then we're all equal, which we are. And I will always say, at every clinic, I get so much more from my patients than I feel they get from me. It is the most beautiful exchange, and it always goes both ways. And the healing isn't something that I give to them. It is something that happens within them and for them, in the space that we co-create. And I am there with my medical knowledge, but more than that, I am there as a compassionate listener. I am there as a space holder. Space holding is not passive. Space holding is a very deep, active process, which requires the healer to be fully present, to be regulated, to be willing, and also to be able to hold. But the healing happens because of that co-creation of this healing space. And then also, when we're talking about healing, what I feel is really important is to ask oneself, what does healing mean to me? Because we often, I feel, feel or equalize healing with cure.
Yeah.
And these are one of the same.
Mm.
Healing can be cure, by all means it can, but does it have to be? And something that I always would like to offer when I can, and when I feel that there is permission, right? We don't do things without permission, is, what does healing mean to you? Let's sit with that. Let's really get intimate with, what does healing mean to you? And it can mean different things to different people. So I feel that that is very, very important. Yeah. And then you asked where can people find me? They can find me on my Instagram, Alex the Heal Clinic, and also through my website, which is thehealclinic.com. And also on my LinkedIn, which is also a good place where I'm present more and more.
Oh yeah, I love LinkedIn. Oh, thank you, Alex. Thank you for that. Because I know that's been, it's a word that I resonate with, and because my definition of it is finding your wholeness. So and like you say, it can be cure. That can be a byproduct of it as well. And I've definitely experienced that in my own healing journey, but as a healer as well, I've seen it as well. So yeah, thank you for having that on this platform. Beautiful. And thank you so much for connecting. And I know, like, I'm in summer here in New Zealand, or autumn actually. We've just turned into autumn, so you must be turning into spring. And
back to winter, in fact.
Oh, okay.
We're just riding along.
Oh, totally. Like, I just get on the broom, sister.
Yes.
I expect the unexpected. That's my saying. Yeah, but I can't wait. I can't wait until we one day meet in IRL, in real life.
Yes, I feel like we've known each other for probably a few lifetimes, and not just in this one.
I know. It's true.
So it will be rather lovely to actually give you a proper hug in person, many of the virtual hugs that we've had over the course of the past 3 years.
Exactly. Oh, I can't wait. I can't wait. And thank you so much for sharing, all of you. And I just want to end with that. Heart Place Hospital is caring for our carers in the front line, and it's giving them these opportunities of experiencing whole person health, and the way that we see that we can do that is by having Heart Place Hospital as a charity, so that those in the front line have access to it without any barriers. And we're really excited. We've got our biggest fundraiser yet coming up in June in the village that I live in, Mangawhai in New Zealand, Northland. And so I just wanted to end with, if anyone's listening and wants to come and have a day of sport and fun, raising awareness and funds to support our frontliners to have these opportunities of healing. We know that the ripple effect of that is huge in our society. We want to keep our frontliners in New Zealand. We want to keep their expertise in New Zealand, but we also want to make sure that they're being cared for, valued and respected for everything that they deserve. And we know the ripple effect of that out to the society is just so huge. So yeah, we're really excited about our big fundraiser in June.
That's incredible, Jackie. I just had literally goosebumps from head to toe, because I feel that there could not have been a better steward of this mission than you, and deeply grateful for you.
Thank you. So it actually means a lot, because I know how powerful your intuition is. It means a lot to me. Thank you so much for seeing that in me. I really appreciate it.
Greatest pleasure.
Yeah. Talk soon. Bye.